Hello everyone, welcome to sqadia.com. Today the topic of our lecture is the neuropsychiatric manifestations of any endocrinal abnormalities. So basically the endocrine system consists of the 8 major glands of your body, and mainly it consists of the pituitary gland, the thyroid gland, we have the adrenal gland, and then we have the pancreas. So these are the major glands of our body, and it's basically affecting all of the functioning of our bodily systems, including the growth and the development of the body as well as the metabolism. But any abnormality that is regarding these endocrinal problems, it is also going to affect the psychiatric abilities of that problem. Psychologically, even that person is going to be affected. Why is this happening? It's because of the fact that these glands are also affecting the sexual functioning of the person as well as the mood of the person. So that is why all of these neuropsychiatric manifestations are present in a person with endocrinal abnormalities, and that we'll be discussing over here. Primarily in the very first section, we'll be concerning the condition which is known as hyperthyroidism, and we'll be discussing the history of this condition, of course, and then we'll be moving on to the key points of consideration of such a condition. Then we'll move on to the thyroid diseases. What are the different sorts of the thyroid diseases depending upon whether there is a thyroid insufficiency or whether there is an excessive thyroidal hormone secretion. So both of these conditions will have their own impacts on the bodily systems. In the second section, we'll be concerning the hypothyroidism, mainly over here. First of all, obviously, defining this condition is very important, and then we'll move on to the neuropsychiatric complications of this condition. Finally, we'll be discussing the mood disorders, which are also regarded as the affective disorders that we'll be discussing over here in this section. In the very third section, we'll be discussing Cushing syndrome, which is basically the hypersecretion of the adrenal glands due to the hypercortisolism. All of these conditions arise, which is known as the Cushing syndrome. And in this syndrome, what are the neuropsychiatric manifestations of the person? We'll be discussing them over here. Mainly, we can see psychosis, we can see mania, and then we have hypomania. Such a psychosis is also known as myxedema madness. So this is what we'll be discussing over here in the very third section, and then we'll be moving on to the fourth section, which is mainly the Addison's disease, characterized by the adrenal insufficiency over here. We'll be discussing the neuropsychiatric manifestations of such an adrenal insufficiency. Basically, the hormone cortisol is in low levels in the blood serum, and we'll also be discussing hyperpituitarism. Just giving an introduction to you over here in this section. In the fifth section, we'll be discussing acromegaly, which is basically hyperpituitarism. Basically, it's the clinical picture of hyperpituitarism, and then we'll be moving on to hypopituitarism over here. The neuropsychiatric manifestations will be discussed over here, and then we'll be moving on to the treatment guidelines of acromegaly. What are the different treatment modalities present? We'll be discussing them over here, and then hypopituitarism, and along with its neuropsychiatric manifestations, we'll be discussing them over here in the fifth section. So I hope you want to learn more about these endocrine disorders, so do watch the other sections to this lecture as well.